This is the Healthcare Summit, the Governor's Healthcare Summit. What we're doing is pulling together all the stakeholders that are involved in healthcare. We're beginning our Mississippi Healthcare Solutions Institute. Dr. Clay Hayes, a noted cardiologist in Jackson, is managing that for us. This is about creating jobs in the healthcare industry as an economic driver across the state of Mississippi, and beginning to be able to adapt to the coming needs of the healthcare industry because of the baby boom generation that unfortunately will be moving into the area of needing healthcare very soon.
This is the Mississippi Economic Council, the State Chamber of Commerce, and we are involved in really promoting opportunity for the state. We've partnered with the governor and a number of other associations in holding this conference on healthcare as an economic development driver. So it's really the next big thing. You know, we went after the automotive industry about 10, 15 years ago in a serious way. And look at what's happened. I mean, the whole face of manufacturing in Mississippi has changed to an advanced manufacturing from low wage, low skill to middle skill economy. Significant improvement. So where can we go with healthcare? Tremendous opportunities. And so what we're doing today is looking 10 years out. We're looking 10, 20, 30 years out instead of looking at the challenges of today. You know, what's going on from a national healthcare point of view is an issue that is today's issue, but we're working on tomorrow's issues.
How do we use the business of medicine to help the economic engine of Mississippi? That's the main focus that we want to try to do today, is to say we have such a great medical system and community here in Mississippi, and how do we grow that and to have other jobs related to the medical field?
What kind of potential does this offer?
We think it's huge. We have a lot of physicians and a lot of nurses in our community, but we don't have enough, and so we're trying to grow our medical school class sizes, our nursing class sizes, and to grow our community so we have better health care in Mississippi.
Please join me today in welcoming the chair of the Mississippi Healthcare Solutions Institute and the chair of this conference, Dr. Clay Hayes.
Thank you very much. Well, thank you and good morning. And thank all of you for being here. I know it's a busy day, a busy schedule, and we want to make sure everybody gets something out of this. And so we are here today to talk about Mississippi's future, and not its past, and really not about even its present. And that is why I hope we can keep an open mind and also an open heart to put aside the challenges that face all of us today in charting our way through the current public policy related to health care. Today we talk about new opportunities for healthcare economic development in Mississippi. It may seem like we're all dreaming, but with the right plans and the right resources and the right people, we can make this work a reality.
When I have an idea, usually part of it is borrowed from someone, and some I try to add to myself. That's all right. A good idea is worth passing around. I first found out about the Houston Medical Center in about the 1970s when my dad had a heart attack. Now, he worked for the Jackson Mack Company. He was a diesel mechanic, and how I'm not really sure, but his boss at that time and the insurance company that provided coverage for those working men and women decided that if he didn't have an open heart surgery, that he would not survive. My dad was 43 years old. So they decided they were going to move him to this place in Houston, Texas, and a couple of doctors out there, Dr. DeBecky and Dr. Cooley, starting this new radical program where they could go inside your heart and take veins out of your legs and transport them and put it back all together. Well, it sounded pretty challenging to all of us, and poor little kids that we were, that our dad would be so far away in this new dramatic procedure. My dad lived to be 73. Now, that was some of the very first opportunities that we had and almost anyone had heard of that radical procedure called open heart. And his life was extended because of Dr. Jimmy Hayes, Dr. Clay Hayes' father, who continued to provide the world's best health care for my dad until his final days. And so I have a personal stake in seeing others have the opportunity to explore some of the great healthcare innovations across the world. And so as I became governor, I remembered Houston, Texas. I began to read about economic development and how hospitals and physicians and nurses and pharmacists and the healthcare management institutes were all helping drive the economy in so many of these states, what was going on in Orlando and what was going on in Nashville and San Diego and Houston, Texas. And so I got a hold of some Dwayne O'Neill, and I said, we need to go to Houston. He said, absolutely, we'll line some folks up, we'll take off. And there we were with Dr. Warnetti and visiting his staff and seeing that remarkable medical city. And indeed, it is a city. And I thought of Jackson, and I said, as the hospitals we have here, we can do that. It may not be on that level, but we can certainly have a medical corridor here. And we began to explore that idea. Then we looked at the rest of the state and said, why just keep it in Jackson? Why not let everyone have medical zones? Why not use this great thing we call health care that God has given us through our wonderful physicians and healthcare providers and extend it to a growing economy? Healthcare is an economic driver. So, of course, we had to call Blake Wilson. You can't do anything in this state without MEC. I've just found out if you're going to get anything done, call Blake Wilson and Sandy Maxwell, and they will get it done. And the event that you see here today, the invitations, much of the materials that you have in your chairs and that you'll hear from today, the speakers, all of the details that go into having a summit with 800 people are because of MEC. And I'd like for you to take a moment and thank them. Blake, I don't know where you're at. Sandy, but thank you so much. Great job. Now, you're going to hear some great speakers today. Bob Hess is going to tell you about the study, the Blueprint Mississippi study that was put together that I asked, again, MEC to do when Haley Forsackerly was chairman there. And Haley stepped up immediately and said, we'll begin to do the research for you, so we'll have some type of roadmap. You're going to hear from Dr. Warnetti, from the President Emeritus of Texas Medical Center, where he's been since 1984. We will show you the roadmap into the future. We will hear from Dr. Hannah Gay, as y'all all know, has done something remarkable of helping cure a child of HIV/AIDS, and the world has taken notice. We here in Mississippi have phenomenal opportunities in health care. Now, we have wide differences and debates, and I understand that because, you see, each industry that I work with, whether it's energy or the automobile or aerospace, the same differences occur there. Each one of them have different ideas. They argue about where plants should be, and should we have electricity in automobiles, or should we move forward with compressed gas? Oh no, they say, leave this combustion engine alone because the price of oil will go down and our drilling won't be as proficient. You see, all those challenges go on in every business, so don't think you're alone. Now, you do have some great challenges. You have doctors. I love physicians, don't you? I mean, I love them, but they're physicians. Come on now, guys. You know, I mean, if you've been to medical school, there's a certain characteristic that doctors have. But if you can channel that world's knowledge and energy, then marvelous things take place. Just ask Dr. Hannah Gay. So we're channeling much of the energy and the intelligence, the determination of the physicians that are here today. But this industry is so vast, from insurance to manufacturing, pharmaceuticals, to all the support systems that go on, to laundries. I just opened a laundry not long ago in Marion County that does 1 million pounds of laundry a day for hospitals. That's a pretty good-sized industry. They're employing about 100 people in Columbia, Mississippi. I'd like to have about 4 or 5 more of those. You see, those are jobs that oftentimes those folks who live in that area might not have. It is not the high-tech industry that could be in the medical corridor, for example, but to a family working there in Marion County, it's just as important. So we must come together on those things that we agree on and move forward on them. We can continue to debate those things that we disagree on, and that's fine. But let us not have perfection become the enemy of the good. I struggled with that during the legislative session. It was always one good idea that we were trying to move forward, and someone would come in and say, it won't work. It just won't work. Well, why? Because this particular chairman's opposed to it, or, you know, we killed a bill that they had last year, so they said they're going to kill this one if it comes over here just to show us they can do it. And, oh, we just don't have the money to do that. And if you know it, next time it'll be a tax increase. And there was always reasons that we couldn't do something. And we always pushed forward to find the ways that we could do it. Now, I think we can make Mississippi, and particularly this great metro area, a center for the healthcare industry as an economic driver. Look around the room, you'll see a lot of us folks that are called baby boomers. Now, we've driven this economy since hula hoops. Every time we want something, every time we have to have a product, it explodes, whether it's convertible automobiles or houses. Next, it's going to be healthcare. And if we're not prepared for that, when the 40, 50 million baby boomers in about a decade rush to the hospitals and to the doctor's offices, and they say, well, you're going to have to call us back in about 6 months. That's as quick as we can get you in. We've got to start preparing today for that eventual day where we will be there. So we'll talk more at noon about our new medical school, which I'm very, very proud of. Let's just say if we did nothing else in this administration, to help build a new medical school should have been enough. I mean, I could go on as governor and say I was there when our new medical school started. The last one was in 1954 that it was built here. But that's not nearly enough. A medical corridor is what we need. You'll hear about workforce housing, that how we're working with a Home Corp in Mississippi to give the highest tax credits possible for workforce housing in and around the medical communities. You'll see new hospitals that are up and moving and how the state's doing their very best to help them in economically every way we can. You're going to hear about the medical city at Houston, Texas, and how it began and how it's flourishing. I want to thank our great United States Congressman Greg Harper for being here this morning. And Mr. Congressman, we could not do it without your help. I read this morning in the Clarion Ledger that Congressman Benny Thompson said he is supportive of our medical corridor. He believes it's a great idea. As a matter of fact, I haven't met anyone that said that's a bad idea. And in my world, that's an unusual thing. There's always somebody that's been against something, and particularly ideas that I might have. But no one I run into says, you know, I think that's a terrible idea. I think expanding a medical corridor from Rankin County all the way to Hawkinsville and making that the area of energy and vitality and dynamic growth, to live, work, and play for the medical community in this area, I think that's a terrible idea. No one has said that. Why is it not happening? Why are we moving faster? Well, hopefully, we'll talk about some of those reasons and find some of those solutions. First off, have you ever tried to get a bunch of hospital administrators to sit down and talk to each other? Not very easy. I'm just going to tell you now, I've done that a couple of times, and the synergy in the room could probably tear the curtains at the temple. But we're going to make them sit down and start working together. They can do that. I know it's a very competitive world out there, and being a hospital administrator is about as bad as being governor. I love at times when they begin to tell me the challenges of trying to manage the hospital. You ought to try to be governor. The challenge is there. But coming together with those things that we believe that we can do, moving forward, showing the rest of the world. We've had great successes here in Mississippi. The American Legislative Exchange just rated Mississippi as the top 10 in the top 10 for economic development opportunities. Now, if you noticed, just recently we surpassed $100 billion in our GDP in Mississippi. That's right, a billion with a B. You'll see some numbers that will come out for unemployment here about the 19th of this month that will indicate we're trending in the right direction. Whether it's Nissan's new supplier part or Yokohama Tire Company, great successes are occurring every day. Just yesterday, I was out with a company and filled up the very first automobile from the very first distribution center of compressed natural gas in the state of Mississippi. There will be hundreds across this state before long. Will have a dramatic effect on business and individual cost of living and quality of life. I won't go on any longer. I will tell you, if you have an opportunity to take a look at this particular folder in your chair, It helps explain to you a little bit about what we're doing in the healthcare zones, how the state of Mississippi is trying to encourage private sector investment. Now, I'm going to shock you by telling you today is not all about what the government can do for us. Because if we keep standing by and thinking the government is going to solve all our problems, then we truly will fail. I am of the opinion that the more that we get the government out of health care, the better off we would be. I know that's shocking to you. Everyone calm down for just a moment, but think about that. Now, if we just got to the position again to where we had faith-based organizations like the Catholics and like the Baptists and like the Methodists helping us deliver our health care, which they do now. If we were looking to the private market again as a driver for health care in this country, if we didn't have the federal government, we weren't so dependent upon the federal government to be able to open the doors of every hospital every day, it seems as if there was a time when we could make it under that model, and now we can't. We believe we can't. We're going to work hard. We're going to come together for all faiths and denominations, geographical locations, nationwide, statewide, worldwide if we have to. But I can assure you the challenges of health care that we face here in Mississippi are great. We lead in many of the categories you don't want to be at the top of the page. Whether it's obesity, heart disease, diabetes, we seem to be the leader in those categories. So we're going to work hard to make sure that we have access to health care here in the state of Mississippi and that jobs are being provided in that industry to help grow this state. Thank you so much for being a part of this today. I believe it will be a great benefit to you. I know it will be a benefit to the state of Mississippi. Thank you.
Now, you don't have to know everything about this industry. You can look at what other people have done. And I know you've been over to the Texas Medical Center in Houston. Fantastic. I've been over there too. Actually, I was on the roof where the helicopter comes in, and I got to understand that whole cluster. What an amazing, amazing cluster. But let's hold on a second. There's other rural states and opportunities out there. One of the case studies we profiled in the study was Grand Rapids, Michigan. It's a rural state, right? Grand Rapids, probably pretty similar size to Jackson. This is an excellent case study. They have developed something called their medical corridor. They call it the Michigan Street Medical Corridor. They call it Health Hill. They call it Pill Hill. Okay? Tremendous collaboration. $1 billion in growth. Right now, they're seeking grants. They've done some excellent, excellent work there. I would encourage you to tour the Grand Rapids Medical Mile and learned about lessons they learned about linking healthcare to urban development. Okay? Sometimes economic development, urban development can be two different things, but you should correlate them very closely here. And then working with private organizations. This was the lessons learned on that case study. Tremendous amount of capital flow that went between the entities. Collaboration, cooperation, the philanthropic nature, just an excellent, excellent case study. And they've also got a new medical school there. So $90 million. So I encourage Dr. Clay and the team to visit there, these clusters, understand what they've done. And yes, you want the aspirational Texas side in Houston, but you want to understand what's going on in rural states too with some of these corridors.
Mississippi is on the move. And one of the things I talk about all the time is how we've got to develop a Texas-style attitude here in Mississippi. And I was talking about that, and somebody said, well, what about a Mississippi-style attitude? Okay. But we got to make a reputation for saying, yes, we can, instead of, oh, we apologize. We've got nothing to apologize for, folks. We've got to get together and focus on the future. You know, you've never heard a Texan look down at his shoes and say, well, I'm just from a poor state. A Texan might say, I'm temporarily broke, but he's never going to say he's from a poor state. And so we have with us today a great leader from Texas. Gentleman that Trey Hairston's been telling me about for the last couple of years. The governor has been bragging on him. He really is a pioneer and set an example that we all can follow. It's Dr. Richard Winerty, and he's President Emeritus of the Texas Medical Center. He served as President and CEO of Texas Medical Center from 1984 through 2012. During his tenure, the campus increased dramatically by almost any measurement, including number of acres, patient count, employees, student enrollment, the physical plant, and the amount of money awarded in research grants to the institution. You name it, you can measure their growth in leaps and bounds. His leadership was one of the successful coordination of a 54-member institution campus by encouraging collaboration. Folks, what did we say was important? What did Bob Hess lead us in focusing on? What do we know makes a real difference in Mississippi? And folks, I think this is Mississippi's secret weapon. While Texas has a Texas-style attitude, Mississippi has a unique secret weapon because we are a relatively small state. 3 million people scattered over a lot of geography, but the interconnections that we have, because we're a small state, set us apart. So if we can leverage these interconnections and focus our secret weapon on solving a challenge like this, that will help us develop that Mississippi attitude and follow the lead of that Texas-style attitude. We're going to hear today from a leader from Texas who can say, if you get the right people around the table, if you get the right plan in place, you can and will make a difference. It is a great honor that Dr. Wainerty has agreed to come here, to take his time to help share with us how Mississippi can be a better place in healthcare economic development. Please join me in welcoming the President Emeritus of Texas Medical Center, a visionary pioneer in this field, Dr. Richard Wainerty.
Amarillo, Texas came to me 30 years ago and said, we'd like a medical center like this. We were a third the size at the time. They took our bylaws, they took our charter, and they started the Harrington Medical Center in Amarillo, Texas. And I don't know if any of you have been to Amarillo, Texas, but the way in from the airport in Amarillo, Texas does not look like the way in from the airport in Jackson, Mississippi. It's lots of nothing. And today, at the Harrington Medical Center, 1 million patients a year or more come every year from 5 states. Now, why do they do that? They do that because they get great care at the Harrington Medical Center. City of Buffalo, New York is starting a medical district in the middle of Buffalo. It's doing very well. They have 9 institutions in it now. They call it the Buffalo Niagara Medical Center. In Denver, the city of Aurora and got the old Fitzsimmons Army Hospital, and they're building a wonderful complex with the University of Colorado and everybody coming in. There are a lot of states doing this. I run around the country talking to lots of people. I have never, in the whole United States, seen his enthusiasm that I've seen this morning and the kind of thing I read in that report and what the governor has put together. I haven't seen it anywhere. There's no reason you can't do this. But it is very important, really important, that you have your plan, that you follow your plan, and that you don't figure that there's some reason that you can't do it. For example, just to give you an example of what's in your plan that I think is so strong, is hooking it to economic development. I've never heard of anybody just hooking it that way. Most of the ones talk about, well, we'll have better health. Well, you're going to have better health. But hooking it to economic development gives you something that's sustainable.
What have you learned in Texas that can benefit Mississippi in this area?
I think the thing that we've learned the most is that the key to success is for the institutions to work together and to realize that their competition is outside the state, not inside the state. And so our goal at the time was to keep our folks, keep doing their health care at home and not traveling to some other place.
UAB is ranked 5th of the top 15 academic institutions as a place to work in Scientist magazine. We've just finished the 23rd consecutive year as a top 100 U.S. hospital. We employ 23,000 people. and are responsible for 51,000 jobs in Alabama. We are the largest single-site employer in the state of Alabama. Our annual economic impact exceeds $6 billion, and our focus areas are 6: cancer, neuroscience, cardiology, diabetes, infectious diseases, and rheumatology. We were one of the first 11 comprehensive cancer centers designated by the National Cancer Institute. Here's a shot of what is a cluster, sort of along the lines of the corridor that you're talking about developing, Governor. But if you'll see, at the heart of the cluster is the Academic Medical Center. We actually have 5 hospital facilities on the UAB campus that are university-sponsored hospitals. The clinical program, the Kirkland Clinic, is located there. The Veterans Hospital is located there. The Children's Hospital is located there. A charity hospital, Cooper Green Mercy Hospital, is located there. But surrounding it are medical centers in the rest of the community. One of the things that we have attempted to focus on is the development of collaborative relationships between the university and those other healthcare enterprises in this area.
What potential does that hold for Mississippi?
I would think that it would be huge, in fact, given the presence of the University Medical Center here and the complementary other regional medical centers here, as well as the community hospitals around the state.
These plans just did not happen overnight. A lot of work, stakeholders involved. Now, it's implementation time. It is time to make sure that they come to fruition. If I looked at those numbers correctly, and if all of those plans would work as they have been proposed, we would create some 5,700 jobs. And that's almost 3 Toyota plants, maybe 2,000 folks that work there, a little under that. So that's maybe 3 Toyota plants for the state of Mississippi. Now, if we thought that we could get 3 more Toyota plants, we would turn the world upside down. We'd be asking the legislature for $100 million in money so we could go incentivize to get 3 more automobile plants that have 2,000 employees apiece. We can do it. We've already saw it. We know the plan's there. We know we can make it work. We've got over 800 people that will be present here today, and those are stakeholders all the way from pharmacists to doctors to hospital administrators, those in the business of identifying the growth patterns for the healthcare corridor in the city of Jackson, for example. Many of our legislators will be here. This will be a huge, prosperous day for healthcare in the state of Mississippi.
Go to mec.ms, www.mec.ms, and they can download the studies and sign up to be a stakeholder.